I'd like to reconvene our public session and to lead off this portion of our meeting with our second panel. The title of the panel is Bedside to Bench, How Health IT Can Better Power Clinical Research. That was the first panel. I know. I'm just trying to see if people are paying attention. Right. And I love Steve's last slide about I feel so much better because I don't often achieve, so I think I'm probably doing the right thing. All right. Being a physician, I've worked with nursing all of my practice career, and most importantly, I'm married to a nurse. I have a huge respect for nursing, and very pleased to have this panel here today. The title is The Backbone of the Healthcare System, Nurses' Critical Role in HIT Implementation, and I'm very pleased to have Linda Fischetti, who's not only a nurse, but she is our NEHC, a federal liaison, and is a Chief Health Informatics Officer for the Veterans Health Administration now, and has been a real leader for the federal government with NEHC since its beginning. So, Linda, if you would please introduce our panelists, and then we'll get started.
Thank you, Dr. Tooker, and thank you for the rest of the NEHC panel for soliciting this presentation. And we would also like to thank Merit for the wonderful outreach and communication campaign. She actually did outreach to a number of the nursing communities, and I think we have over 100 people online, so thank you, Merit, as well. One of the things that I do want to speak to just quickly before we hand it over is the role of the nurse informaticist. We know that the American Nursing Association has a scope and practice of nursing informatics. They have actually a professional certification for nursing informatics. And as an employer of many different types of informaticists, pharmacists, physicians, nurses, social work, health information management, and folks who don't come from the clinical disciplines, we've actually been able to leverage that work from the ANA because of the fact that it was some of the earliest scope and practice for informatics work that was out there. So, and we've been able to use it across multiple disciplines, as well as to use it as an educational infrastructure for where we need to grow our workforce. Within the American Nursing Association's informatics discipline, there's three main sciences that converge to make the informaticist. And so it's computer science, health science, and then systems science. And so that's what you'll hear a lot of today as we hand it over to the broad panel. So it is my honor, actually, to host these colleagues. I'm usually sitting in the audience listening to them speak, and so it's a pleasure to be up here sitting next to them this morning. The first person who will be presenting today is Victoria Bradley. She is the Chief Nursing Informatics Officer at the Eclipsys Corporation. She works closely with clients to determine priorities for solutions that support the clinical and administrative practice of nursing. She also provides guidance in the development of these nursing solutions. Currently, Dr. Bradley also serves as Assistant Professor, Adjunct Faculty for the University of Kentucky College of Nursing. Previously, she was a Director of Patient Information at the University of Kentucky Healthcare, where she was Project Director for implementation of an enterprise-wide integrated clinical information system and administratively responsible for the Hospital Medical Records Department. Her experiences include system selection, contract negotiation, implementation, evaluation. She discovered her passion for informatics by leading a project to develop a computerized tracking system for an emergency department. Dr. Bradley is also currently the president of the American Nursing Informatics Association. Dr. Bradley.
Thank you. Are you introducing everybody or just me? Now, just me.
Why don't we just do you? Yep, okay. You go ahead.
All right. Good morning. It's a pleasure to be here to talk about my passion, nursing informatics. And I'm not on. Okay, good morning. It's truly a pleasure to be here this morning to talk about nursing informatics. I did start. My clinical expertise was in emergency and trauma care, and while I was director of a busy academic emergency center where we were losing patients and we were overcrowded, we followed the typical path of looking for a system that would help us take care of those patients. And of course, we couldn't find one in the vendor community to meet our needs, so we decided, we didn't know any better at that time, to develop our own. So worked with a creative programmer, and we developed an ED tracking system. And so it was great that we were able to then see what our patients needed. We knew what needed to be done, what we were waiting for, but then even better, we were able to get aggregate data so we could really identify what were the bottlenecks, and what resources and what things did we really need to change in the department. So after that experience, I became a true believer and passionate about information technology, because I found that we could really make changes in many processes that we've always done it this way before, but we could really make a difference. So currently and today, I'm representing two groups, the American Nursing Informatics Association, of which I'm president. I forgot about the slides. Okay, how do I make this happen? Am I pointing it somewhere? Or, yep. I have a witness. I'm presenting the button on, am I aiming it towards something to make it happen? It's like, I love it. That's, okay. Yep. All right.
Okay.
So, the American Nursing Informatics Association is a group that started back in 1992 on the West Coast, and you can see that their mission is really to provide education and networking for the nurse informaticist. They have over 1,000 members, and they are now in 50 states and 5 countries. The other group that I'm representing today is CARING, the Capital Area Roundtable on Informatics in Nursing. And the CARING group started in this area back in 1982. And again, they have a similar mission in terms of looking for ways to improve healthcare through informatics, practice, education, administration, and research. They have over 2,000 members, and they also are in 50 states and 34 countries. So as you see from our missions, we're very similar, and we're currently in the process of merging these two organizations so we can better meet the needs of the informatics nurse and the informatics community as well. So we do a fair amount of education. Many of the nurses, such as myself in the beginning, had no formal training in informatics, so we learned on the job. And so we offer educational opportunities through our annual conference, through webcasts, through our newsletter, and then we work with other groups as well, because it's not just about nursing. We know this is a team sport. We want all clinicians to be engaged and involved. We also are the voice for nursing informatics. We have a long tradition of having an electronic mailing list where all of those 2,000 nurses seek information and advice. We post current events so they know what's happening, such as events such as today, educational offerings, research opportunities, job opportunities, volunteer opportunities. So lots of information goes across the list. But probably the biggest thing that people appreciate is how-to advice. So those 2,000 members are from all kinds of organizations. They're consultants in the industry. They're from the vendor community. They're from acute care, long-term care. They're from academia. They're researchers. And so frequent kinds of questions that are asked range, the gamut from what are you doing with students in your situation with the emergency, with the electronic health record? How are you doing anesthesia documentation? We're thinking about doing or getting ready to implement CPOE. And so we're discussing the pros and cons of a phased approach versus big bang. Can somebody help us? Does somebody have a job description for a chief nursing informatics officer? We'd like to create that position in our institution. We're looking at new mobile devices. Did you do any studies? How did they really work? So these are just common questions, and people answer them from their lessons learned or refer them to someone else, and it's actually like a mentoring avenue as well, because people are connected from across the country and from across the world. Nurses are critical, we believe, to meaningful use. When I looked at the objectives just for 2011, nurses are involved in implementations or part of the or provide the information that will help us achieve meaningful use. We're involved as designers, as educators, as project leaders, as evaluators, as researchers, and all these roles are critical. After successful implementation of CPOE in an academic medical center, and by that time my children were grown and I wasn't a grandmother yet, I decided to go back to school because I was seeing in the industry is how is it you can take one vendor system and implement it successfully in one environment but not so successful in another. So there's obviously much, much more to implementation than features and functions. And so I looked at adoption, what is critical or what needs to be there in order to make these projects successful. And I found, I think the collaboration, nursing, physician, pharmacy, our allied health professionals, they're all being at the table and being involved, from frontline staff nurses as super users up to the chief nursing officer, that they all need to be engaged as part of this project, because this is really not an IT project. This is a project where we are transforming our care delivery systems. The continuity of care document, when I looked at that document, again, nurses are one of the key folks that are entering or collecting that information. So when we talked earlier about research, nurses put in volumes of information, and so we want that information to be of quality so we can use not only to show what the picture of the patient's story today, but also to use it for secondary projects and for research. So if I became ill today in Washington, if I went to an emergency department, I would want someone to know me. I don't want to be a stranger. So it's critical that this information is captured and transferred from site to site where I am receiving care. So again, all the areas that are highlighted in areas are places that the nurses contribute to the record, as well as we contribute to other parts as well. Nurses spend countless hours determining how best to deploy these systems in our environments. So in our computerized physician order entry project, and I hear it whether it's a nursing documentation project, in clinical settings, nurses are sitting in rooms for 4 to 8 hours a week, they tell me, without break, and sometimes they get food, to look at the system, to really evaluate, to say, okay, here's the best evidence. How can I embed this in the system so it makes it easy for our clinicians to do the right thing? They look at the workflow, they look at how things are displayed on the system, they look at how it's easy to implement this information, what's the best way to train, how do we get the information out to people. These are things, feedback I want to give back to the vendor that I think that it could be improved. So nurses are spending countless hours building these systems for us. And nurses as informaticists are translators. So we have long translated between physicians and patients and the pharmacist and the other disciplines, and now we translate between information technology and clinicians and patients. So I don't know how many times I've sat in a room with the clinicians and information technology and the clinician says, I know that's what I said, but that's not what I meant. So when they're seeing something new on the screen, so we help translate to really identify what the problems are and what the needs are, and to help our colleagues better identify ways to solve those problems. So nurses are active locally, and they're willing to become more active at state and federal levels. And while we feel that nurses are the backbone, we are also one of the brains behind successful healthcare transformation. Again, as I said, it takes all of the healthcare disciplines and our vendor partners to collaborate together to be success. We as nurses did not go into healthcare to watch people wait for service, to make mistakes, to deliver substandard care.